Hello, and thank you for choosing Note Designer Psychotherapy Note Writing Software for Mental Health Professionals. In this video, the second of two parts about types of therapy progress notes, I am going to review some specialized note types that clinicians tend to use in the course of their day-to-day practice. Please note that this will be more of an educational presentation explaining the different notes and not a comprehensive tutorial about Note Designer itself. We do, however, have other videos that focus more specifically on how to use Note Designer and all of its options for customization, which you can find on our webpage or in the Help menu. The two types of notes we will consider in this video are Risk Assessment and Treatment Planner. Let's start with the very specialized note, Risk Assessment. A risk assessment note is a way of documenting in a systematic and organized manner all the pertinent details concerning a risk assessment interview or from a session in which a risk assessment was deemed indicated and therefore conducted. A risk assessment aims to carefully evaluate and ascertain the degree to which an individual may be considered to be at risk to themselves or to others. This is, of course, a very challenging aspect of our clinical work, emotionally, ethically, and even legally. I would rank this type of clinical note as the most important and essential when it comes to precise and careful documentation. Let's take a closer look now at the different elements of a risk assessment note, using the risk assessment note type in Note Designer as our example. As with all note types, we begin with documenting the demographic information. So in Note Designer, we would go to the Headings tab and enter things like the client's name, date, start time, end time, fee, and CPT and diagnostic codes as needed. You may also note here if there is some special context of the assessment. For instance, if this is part of an intake procedure at an institution, maybe part of an employee assistance program, or perhaps taking place in the context of a court-mandated evaluation. Next, let's go to the State tab. Here we can enter a number of different parameters as needed. So we can enter the location of the session under Session Format, the client's approach to the session, and we can also note any observations we think may be important regarding the client's physical appearance. It is then that we can enter the observed and reported affective state of the client, some information also about their mental and cognitive state, and you can also here note any other significant issues that may have been reported during the assessment. The next part of the risk assessment note is the Assessment section or tab in Note Designer. It's here where you can enter a description of the client's global level of functioning, their observed level of functioning, for instance, something like the HUDAS of the DSM, if you so choose, and note also any biopsychosocial factors that may be at play. There is a sub-tab here to note exactly what form your risk assessment took. Was it a structured interview, semi-structured interview? Did you administer inventories and questionnaires, etc.? Here we should really note all inventories, questionnaires, and assessment instruments we may have administered as part of the risk assessment, along with any relevant results. The most important aspect of the risk assessment note is the evaluation of risk. In Note Designer, we click on the red Risk Evaluation tab and can follow it along like this to make sure we have documented our evaluation in a comprehensive manner. In the first section, we document all of our findings regarding observed and reported degree of risk to self, and in the second section, all of our findings about observed and reported degree of risk to other. So, for example, we see here, in the Observed Degree of Risk to Self subtab, we can note the degree to which a client reports or is observed to be suicidal, from denying any suicidal feelings and thoughts, to occasional thoughts of suicide, and further to frequent or constant suicidal thoughts and feelings. Mentioning also whether the client has a plan or the degree to which they seem to have a plan in place for acting out their wishes and feelings. Next, we may note any other significant features that should be noted. So, for instance, noting whether the client has a history of prior attempts, ready access to means of causing self-injury, or any other life factors that may seem relevant to our evaluation of the degree of imminent risk. Then, of course, we detail and give our professional opinion regarding the client's estimated degree of risk. Here we may think of this as an evaluation of the degree of likelihood of the client imminently acting out their suicidal thoughts and feelings, from negligible through to moderate, and then to extremely likely and of significant concern. The same type of documentation is then done regarding any degree of risk of harm to another person. Again, going through our observations, any significant features to note, and our conclusions regarding the degree of likelihood of the client imminently acting out their homicidal thoughts and feelings. In the next section, we then document any interventions we may have implemented. In the Note Designer Risk Assessment, the intervention types are organized according to theoretical orientation: supportive, CBT, psychodynamic, and some others, and include the specific types of interventions most likely used during a risk assessment interview or session. It may also be useful to document or make mention of the client's response or reaction to the risk assessment session and any interventions you may have made. Last, we note all of the recommendations and plans made based on the assessment, including the clinical course of action and/or any treatments that may be necessary. In Note Designer, the Plan tab begins with the subtab Risk Response Plan, and it is here that we document what exactly we did or will be doing to address any risk of harm to self or other that may have been discovered during the session. We might note our ongoing treatment plan, as well as any therapeutic tasks assigned, and the time and date of a next appointment, if relevant. In Note Designer, we also offer several text boxes throughout the template to use as needed to write any additional comments, as specific details may be particularly important in a risk assessment note. Please remember to then sign your risk assessment note. In Note Designer, you can upload your signature or create one with our electronic writing pad and export it and upload it to your electronic file system, or if you happen to be old school, simply print it, sign it, and store it away in your locked filing cabinet. The next specialized form of note we will consider here is the treatment plan. Typically, a treatment plan is conducted at the outset of treatment and can be referred to throughout the treatment so as to monitor progress and movement of the treatment. A clinician may also periodically revise and therefore update the treatment plan every few months or in keeping with the changing needs of the client. Let's see what constitutes a treatment plan and how we may document this. Turning to our Note Designer program, we begin with the Headings tabs where we record relevant demographic information. So we have the client's name, perhaps their date of birth, occupation, marital status, address, date of the intake, CPT codes, and such. Next, we have the Issues tab. This is where we document all of the presenting difficulties observed and/or reported by the client. Though these may be limitless, in Note Designer we have organized possible types of presenting difficulties into different categories. So here we see affective, grief and mourning, relational, sexuality, work and school, trauma, addiction, and so on. We might choose to organize the presenting difficulties into primary and secondary, as we see here in Note Designer. It is here where we may also make a note about the client's overall level of functioning and all of our diagnostic impressions. So in Note Designer, here we can enter different levels of functioning and then some diagnostic impressions, organized in a manner that roughly follows the standards of the DSM. We also have a space here to document any relevant biopsychosocial factors. The next aspect of a treatment plan is to note all identified goals and any specific objectives of the treatment. Again, as there is an almost limitless number of possible goals and objectives for a treatment, in Note Designer, the content areas are organized according to different topic areas. So here we have goals related to the therapeutic process itself, often important in the beginning of a treatment, overall emotional well-being, self and identity, mourning, and so on. And of course, you can also customize this by adding goals and objectives that you need and are not included in Note Designer's default list. You'll also see here we can identify any of these topic areas as being either primary goals, secondary goals, or documented as the focus of a specific therapeutic objective. As a reminder, a goal is typically an outcome that is more general and may be achieved over the long term, whereas an objective is typically a measurable specific outcome that is shorter in term and often necessary to attain as part of moving towards the more general goal. This brings us to the last section of the treatment plan, which is the plan itself. In Note Designer, we click on the red Plan tab. Here we can document any therapeutic interventions that we believe will be needed to move towards our objectives and goals noted earlier. We can further divide the planned interventions into primary and secondary interventions, giving some emphasis to what we may need to prioritize. As with all Note Designer notes, the planned interventions are organized according to different theoretical orientations, supportive, CBT, psychodynamic, as well as some other types of interventions, such as those that target specific areas of difficulty, symptoms, or disorders. In plan, we can also note here any significant developments. This would be the case in an ongoing treatment. Some general statements about the therapeutic plan going forward will also be noted here, and any areas of concern that are remarkable. As well as here we might note the time frame for meeting our primary and secondary goals, the specific objectives, and the estimated overall time frame of the treatment itself. And that finishes our treatment plan. Just add your signature and export it and upload it to your electronic file system, or if you've not yet moved over to electronic files, use the old print it, sign it, and store it method. This has been Patricia for Note Designer, the leading creators of psychotherapy note writing software for mental health professionals. If you have any questions or comments about Note Designer, please feel free to send us an email at info@notedesigner.com. We are always happy to hear from you.